Hi, this is Dr. Bernard Beldholm, and in this video we're going to have a talk about the recovery from abdominoplasty post weight loss. Now it's really important that we are specific about the type of abdominoplasty and why we're doing it. The recovery from abdominoplasty post weight loss is very different from abdominoplasty post pregnancy or other abdominoplasties. That is why, if you are post weight loss, this is the video for you. Recovery is really important. That will determine how you plan, how you get support, time off work, and so it's really important to know the exact details of that. Complications is also a really important area that you need to know. I've done a separate video on complications for abdominoplasty post weight loss, so check that out. There should be a link down in the description, or I'll try to put a card up for the video that I've done for that. After major weight loss, abdominoplasty can treat functional issues like excess skin folds and muscle laxity, but the operation is the only one step. The real work really starts at the recovery. And I would say it really starts before that. The patients that I see doing the best are the ones that have done a lot of exercise, they've prepared, they've lost the weight, they're stable weight, and they have good nutrition, and they really put the effort into having a healthy lifestyle. Those patients do really well after the surgery, and also the results are much better with patients that have a quote normal BMI range. So that's a BMI range that's in the normal range or up to maybe slightly overweight, up to 30, BMI 30. Anything over that tends to have a lot more complications, a lot more issues, and not as good of a result. The operation is done in Maitland Private Hospital, and I really like that hospital. I've done lots and lots of other hospitals in Sydney, in Canberra, in other hospitals. So I have a lot of hospitals to compare with. I found Maitland Private is excellent. It's got good staff, it's got ICU, it's got on-site doctors. It really keeps my patients safe. So that's why I kind of consolidated and do pretty much all my operations in there at the moment and the last few years. We have two types of abdominoplasties. We have the standard and we have the extended. Now, generally the standard, which is also called the full abdominoplasty, is supposed to go from hip to hip. More or less no post-weight loss patient is going to get that. And there's also a limited abdominoplasty, also called a mini abdominoplasty, and that's an even smaller incision. For post-weight loss patients, that's very rare for that operation to be done, because the amount of loose skin is usually significantly bigger than that. So the standard and a limited one are very rare. The extended around the flank area is the one that we tend to do for the post-weight loss patients. After your surgery, you will have a compression garment. You will have a compression garment around your waist area. That stays on for 4 weeks full time, and then another 2 weeks after that half time. I usually recommend during the day, because that's when you get swelling from the operation. And some patients actually like to keep it for longer than the 2-week frame, because they feel supported and they feel like the swelling is helping. Now, why is abdominoplasty post weight loss a little bit more difficult operation to recover from? It's usually because the nutritional issues, as well as the really stretching that's happened to the skin, and it's thin, it's a lot of stretch marks, doesn't heal as well as other skin, and that's why you tend to get a lot of the breakdowns, the infections and problems after surgery. The tissue handling is really important. It's a large area that we're cutting out. We're also lifting quite a bit of an area up, so there's always a chance of that fluid collections called seromas. Because we're lifting a lot of skin, you'll have drains. The drains are plastic tubes that will come out your thigh area. They drain away the fluid that sits underneath the skin. And the idea is that they drain away the fluid to stick the tissues together, so that when we do remove the drains, the tissues are a little bit healed, so you don't end up with that fluid accumulating again. So the drains usually stay in for 2 to about 5 days. They can stay in longer, I usually take them out when there's 20 cc's or 20 mils of fluid in them or less, so we can monitor that as time goes by. You'll stay in hospital for about 2 to 4 days. Very rare for anyone to be able to get home the first day, and you'll have wound checks and me seeing you every day. You also have PICO dressings, which is the suction dressings, the dressings that are negative pressure dressings. They stay on for 7 days and we change it in the office. The first day you'll usually have a pain button, pain control. We'll shift you over to tablet pain relief the first day or two as well. And obviously you'll have nursing checks, blood pressure checks, you'll have me checking you. There's a 24-hour doctor that if there was any problems they can check you as well. The first thing to do is get out of bed and be up out of bed, mobilizing as much as possible. And that's to really, main thing there is to prevent DVTs or clots in the leg. And that's why you have calf squeezes. That's why we give the blood thinning injections to try to prevent that. So up out of bed as soon as possible. You will find that the first day you may have low blood pressure or dizziness or other things, so the first day might be difficult to get up out of bed. Once you're up out of bed walking, you'll feel a lot better. The second day is usually a lot better than the first day, and then depending on every patient is a little bit different. Home from hospital is about 2 to 4 days. Once you get home, you'll come in to see us in the practice. For the first 2 weeks is the intense period where you get light treatment, dressing changes. We look at the wounds, make sure there's no problems or infections or issues. At day 7 in the practice, we take the PICO dressing or the suction dressing off, replace it with a tape dressing. You can have a full shower, you can get that wet. The light treatments we do are the 830 nanometer tissue healing light that we have in the rooms, and there's no pain or anything. It's just a light that goes onto your skin, trying to reduce swelling and bruising and improve skin quality. The swelling is going to be worst at about 10 days to 2 weeks after the surgery, and then it will gradually come down after that. So you have to be a little bit patient with the swelling. Once you get through to the 2-week mark, everything should gradually start getting better. Most patients will find that they can be upright at day 10 and then driving and doing a little bit more activities at 2 weeks after. You're walking straight after surgery. We push you out and we're walking and as much as possible, but you can build on that. Gentle exercise from about 2 weeks onwards. A lot of patients get dry skin, and that can be related to the fact that it's been swelling and then it's come back. You get flaky, dry skin. Bio oil, unscented vitamin E oil, E cream, any sort of moisturizer that's not scented, just to avoid wound irritation is really, really good. The routine follow-ups with me will be at 4 weeks, which I'll take some photos and check the wounds, and then there will be 1 month, 3, 6 and 12 months after that. Silicone tape, I usually start that with about 4 weeks onwards. But if you have breakdowns or any wound related stuff, we'll just put that off a little bit, not to sort of put the silicone tape across those areas. You'll find that at 3 months you should be back to doing everything you did before the operation. You're still going to have a bit of firmness, still might be a bit of numbness down the bottom, still may be a bit of swelling. And the scars are still going to be quite red at that stage. From 6 months onwards, you'll find that the scars will fade, the swelling should get significantly better. The swelling does improve up to about 1 year after the surgery, and the scar will mature up to about 2 years after surgery. So that's quite a long process. Usually at the year mark, the scar is a lot more faded. You might find that there is bits and pieces that are raised, and you might find that we may have to come back and just tidy up or do a scar revision for those areas, and that can be quite improve the appearance of the scar quite significantly. Make sure that you maintain your weight throughout that period, and nutrition, exercise, all that is really, really important. So to summarize, we have the first 4 weeks is probably the more intense period. Pico dressings, day 7, we take those off. And the other thing that I didn't mention is lymphatic massage. We now have a lymphatic massage therapist that actually works out of our rooms, and that can be very, very helpful. We usually instruct you, so you don't have to use a lymphatic massage therapist. You can do that yourself, and it's all about massaging the fluid out from those areas and the Mons areas into the lymph nodes so that the body can recirculate that fluid, and that will help with swelling after the surgery as well. So my nurse will usually instruct you on how to do that at home, about 15 minutes in the morning, 15 minutes in the night time, or you can come and see a lymphatic massage therapist as well. A lot of patients get swelling along the ankles, legs, because everything puffs up. So that can be quite helpful, having someone help you with those fluid. Make sure you don't start smoking afterwards as well. Keep that off about 6 weeks after. Some things to look out for. So we have the infection. So if you get a red area that's spreading, or you get a little breakdown, come and see us straight away. Give us a call. DVTs can be dangerous. So DVTs are clots that form in your lower legs when you're not active. It's sort of thing that happens when you're flying or you're having long surgeries. There are some surgeries that are more it's more common to get it than others. So a long surgery, so if I'm doing a lot of combined surgeries, like I'm doing a tummy, breast, arms together, for example, very common for me to do 7-8 hour operations. I usually give you the blood thinning medications for 2 weeks after the surgery to try to prevent this. So that is really important to know that is a possibility. If you get any pain in your calf, go straight to the hospital, emergency department, and you'll get scans done. The other thing is the clot in the leg can go into your lung, called a pulmonary emboli, and that is a very serious complication. You'll need to have what's called a CTPA, which is a CT scan that scans your blood vessels in the lungs. You will have to go to the emergency department and they'll have to do that scan for you. If you do have a pulmonary emboli, you'll need anticoagulation to thin the blood to get rid of the clot. So that's a very serious complication. Luckily, it's not that common, but it is possible. So that's something that you need to really be conscious of. Usually happens about a week after the surgery, around about that time frame. So if you get it, that's something you need to go to emergency department of pretty much straight away. So infections, pulmonary emboli, the other thing is the seromas, or fluid collections. Sometimes you get this fluid, almost like a water balloon feeling. That is not a serious thing, but it's something we have to deal with. So I have to put a needle in that area and pull the fluid out. And the sooner we get to it, the sooner we can get rid of it. Generally needs a couple of needle aspirations done before it goes away. So that's something I just do in the rooms. Generally something that goes away once you treat it. And it's very important that we deal with it early, because if you leave it, the body can wall off that area and you can end up with a problem that we have to go back to operating theatre for. You will get a lot of wound care instructions from my nurse. You'll get the information sheets. You get all of that stuff done in the office, so you don't really have to remember all of this. It's just something to be ready for when you get to the practice, and just be aware of this beforehand. The other thing that I would like to mention is nutrition. Now, I'm not a dietitian or nutritionist, but obviously I'm a surgeon, so I know about nutrition from that aspect. And I have a lot of post-weight loss bariatric patients that have had gastric sleeve bypasses and things, and they do have some issues with nutrition. The key thing is, after your surgery, you need nutrition to heal. So you need your vitamins, minerals, you need protein in your diet. So I do recommend, if you have shakes, protein shakes, that can be quite good to supplement with your diet, especially if you've had a bypass or a gastric sleeve or something that prevents your absorption of nutrition. That is really important that you add that extra protein into your diet. With scars, avoid sun exposure, because sun exposure can darken scars. Weight Try to not be too much fluctuating with your weight after surgery, because you don't want to ruin the result or change the result or stretch the skin out again. Let's go through some frequently asked questions now. How long does recovery take? Well, it depends on what sort of work you do, and it depends on what you mean by recovery. Back to doing everything you're doing now is 3 months. But if you have a desk-type job where you can work from home, you can probably get back to work in about 2 weeks. If you have a little bit more of a heavy work, then you may need 4 weeks to recover. And then everyone is a little bit different, so it may take different amounts of time for each one to go back. But usually driving, going back to light duties, desk-type job is 2 weeks. When can I stand straight and sleep on my side? So side sleeping, a lot of patients like to sleep on their side, obviously. It's more comfortable. I'd say, a week or so is fine. When you lie on the side, you just have to bend your knees up like that, just so that you don't put strain on the wound, especially for the first 2 weeks after. Usually you can stand up straight after about 10 days. When can I exercise again? Well, you're really exercising straight away. You're pushing out, you're walking. But when it comes to heavy duty exercise, you can sort of start very, very gently at 2 weeks. You can do some light weight, you can do some bicycle, you can do some other things just to get going at that stage, and then build that up further as you recover. What happens if I lose more weight after surgery? Well, if you lose more weight, there may be more laxity in the skin tissues. So that's something to keep in mind. And it's one of the reasons why I recommend that you are stable weight and at your goal weight before you have your surgery. I live far away. How do you do your follow-ups? We get a lot of patients that live quite far away. Have a lot of patients from Sydney, a lot of patients from North Coast and the northern parts of New South Wales coming to see me. So we're quite used to dealing with that side of things. There's several things we do to make sure the recovery is still really good for you. First of all, recommend that you stay 10 days in the local area. So you'll stay 2 to 4 days in hospital, then you come in to see me in the practice and see my nurse. We'll do the wound and dressing changes. If everything is good at 10 days to 2 weeks, most of the time it's just routine aftercare after that. So most of the time you don't really need, ideally it would be good if you can, but you don't have to come and see me. We usually schedule Zoom consultations at 2 weeks after, and then the routine follow-ups at 1, 3, 6 and 12 months, some of those we can do with a Zoom call. I do like if you come in, so I'll do a Zoom call. If there's any problems, you can send through photos. I can liaise with your GP, and I always recommend that you book a consultation with your GP as well if you're not coming to see me regularly. So that's one of the key things there as well. Once you are back at home, you can always give us a call and get any further follow-ups from as needed. Usually with the follow-up period, I do recommend that you come at least once, so maybe at 6 months or 12 months, so we can do the proper after photos. I provide all my patients with their after photos, so you'll get a link to a Dropbox folder where your photos are, the before and after photos are there. So it's nice to have those proper professionally done photos that I do for you. So at least once, in that period, come back and see me. My conclusion of the abdominoplasty post-weight loss. Recovery after standard or extended abdominoplasty, and as we talked about, the extended is probably the main one that I do for the post-weight loss. It has to be really planned properly, and you have to be prepared for it beforehand. In my practice, the operation is performed in Maitland Private Hospital, which again, I have changed over time, moved everything there because it's such a good hospital. We can incorporate telehealth as well. Sticking to the compression garment, attention to reviews, staying active, keeping weight stable, and then that will support healing for 6 to 12 months. Remember, this video is general education. You have to see me in person. Everyone's different. Your situation is individual, so please come and discuss it with me in consult. You can book an online consultation with me. There's a link down below. There's more videos on this topic as well that you can go through. Make sure you book your consultation. Make sure you ask me questions. down the comment below so I can answer them and we can maybe produce more videos for you. Hope you find this helpful. I'll see you in the next video.